Hey everybody, my name is Mohammed Raza. I'm a periodontist at Columbia University. I had the opportunity to work under the supervision of Dr. Stephen Wallace, performing many sinus augmentation procedures. Some complications we had, we dealt with at the time of the procedure, the sinus augmentation procedure. Many complications can happen in sinus augmentation. The most common complication is the membrane perforation followed by bleeding and then loss of implant into the sinus. I'm going to discuss two different patients that had two different type of unique complications. The first patient on the left side of the poster is a Caucasian male. He had presented with a chief complaint of missing teeth upper left side. We can see that in the CT scan, the patient has two septa anterior and posterior. The posterior one is a smaller one. Two vertical releasing incisions were made, and colostomy was made using a piezo unit. As we were packing the bone graft into the sinus, we saw a perforation in the distal wall. So we wanted to repair it at the same time so that we can move forward with the completion of the procedure. We used a rigid collagen membrane. We tacked it on the posterior wall, followed by taking a post-op Panorex showing about containment of the graft material. And then after 7 months, the final restorations in place are seen. This is the second patient on the right side of the poster. This is how he presented from having an attempted transcrestal procedure in a private practice. He had the implant dislodged into his sinus. As the patient moved his head into different positions, we can see that the implant was dislodged into different positions. The enterostomy was made using a desk drill. Intentional perforation was made in order to remove the fixture. Fixture removed, and then we repaired the perforation, followed by placement of the graft material. Healing abutment was placed as there was enough height and there was a good sufficient remaining width. There's a final radiograph followed by the final restoration in place. I just want to conclude by saying that if one has a complication during the sinus augmentation procedure, they should try to manage it at the same appointment in order to avoid a more difficult procedure by going in at a second surgical phase. And however, one must be well prepared with the proper tacking kit, the proper type of membrane. And yes, thank you so much for your attention.